Hello and namaste. This is Abhishek, and we have been covering various topics on preventive medicine that are usually asked in USMLE board exams. Today we'll be covering on adult immunization, the first part. The recommendations included in this presentation are based on the Advisory Committee on Immunization Practices. They are available on CDC websites. Today we'll be covering on influenza, tetanus, varicella, herpes zoster, and human papilloma virus vaccine. Coming to influenza, each and every person of age 6 months or more are vaccinated with influenza. So the vaccine available for vaccination is influenza inactivated, that is IV4, or influenza recombinant, that is RIV4. And the frequency of vaccination is every year, usually at the fall, so as to prevent the influenza infection that are usually prevalent during the winter seasons. Coming to tetanus, every individual should be vaccinated with tetanus, especially it starts during the childhood. In adult, that is more than 18 years of age, the first dose is usually Tdap. The frequency of vaccination is administered as a booster for every 10 years. Those persons who are not previously vaccinated with tetanus, they need a complete vaccination series, so that includes the first dose of Tdap. The first dose is usually always Tdap, followed by the second dose of TD or Tdap at least 4 weeks later, and a third dose of TD or Tdap 6 to 12 months later. And thereafter, the same as booster of TD or Tdap every 10 years. Especially in the third trimester, during each pregnancy, the pregnant female are administered with Tdap. Coming to the wound management for tetanus prophylaxis, people who have open wounds or even minor wounds are usually susceptible with tetanus infection if they are not vaccinated properly with tetanus vaccine. So if the person suffers a clean minor wounds and have less than 3 doses of tetanus vaccine in his lifetime, or his vaccination status is unknown, then he should be vaccinated with tetanus toxoid containing vaccine. Tdap is usually preferred if patients have not been vaccinated previously with Tdap. If the patient have been completely vaccinated with more than or equal to 3 doses of tetanus toxoid, then the person will receive only tetanus toxoid vaccine if the last dose is more than 10 years ago. However, persons with clean and minor wounds does not need to be administered with human tetanus immunoglobulin. All other wounds, like wounds contaminated with dirt, feces, soil, saliva, puncture wounds, avulsions, or wounds resulting from missiles, crossings, burn, or first bite, these patients need immunoglobulin if the person have less than 3 doses or unknown history of vaccination. However, he does not need human tetanus immunoglobulin if he has received more than or equal to 3 doses of tetanus toxoid vaccine. And toxoids are administered if he has received less than 3 doses or unknown doses of toxoid vaccines, and he is administered tetanus toxoid if he is fully vaccinated in case the last dose is more than or equal to 5 years ago. Another point to note is that for patients who have been vaccinated against tetanus previously but who are not up to date, there is likely to be little benefit in administering human tetanus immunoglobulin more than 1 week or so after the injury. However, for patients thought to be completely unvaccinated, human tetanus immunoglobulin should be given up to 21 days following the injury. Coming to varicella, candidates are those adults with no evidence of immunity to varicella. So what does evidence of immunity means? It means US born before 1980, except for pregnant persons and healthcare personnel. Documentations of 2 doses of varicella containing vaccines at least 4 weeks apart, diagnosis or verification of history of varicella or herpes zoster by a healthcare provider, or lab evidence of immunity or disease. So the vaccination consists of 2 dose series, 4 to 8 weeks apart if previously did not receive varicella containing vaccine, VAR or MMRV. If previously received 1 dose of varicella containing vaccine, 1 dose at least 4 weeks apart after first dose. Coming to the special situations for varicella vaccination. If the person is pregnant with no evidence of immunity to varicella, it is contraindicated during pregnancy because it is a live vaccine. So after pregnancy, before discharge from healthcare facility, the first dose, if previously received 1 dose varicella containing vaccine, or dose 1 of 2 dose series, that is dose second given in 4 to 8 weeks later if previously did not receive any varicella containing vaccine, regardless of whether US born before 1980 is given. For healthcare personnel with no evidence of immunity to varicella, 1 dose if previously received 1 dose varicella containing vaccine, and 2 dose series 4 to 8 weeks apart if previously did not receive any varicella containing vaccine, regardless of the US born before 1980. Similar recommendations. In cases of HIV infection with CD4 percentage more than 15% and CD4 count more than or equal to 200 cells per mmK with no evidence of immunity, vaccination may be considered, that is 2 doses 3 months apart. Live varicella vaccine is contraindicated for HIV infection with CD4 percentage less than 15% or CD4 count less than 200, and it is also contraindicated in patients with severe immunocompromising conditions. Coming to herpes zoster vaccine, candidates are persons of age 50 years or older. The vaccine is usually RZV, that is Shingrix, which is a recombinant zoster vaccine. It is a 2-dose series recombinant zoster vaccine given 2 to 6 months apart. The minimum interval is 4 weeks. You have to repeat the second dose if it is administered too soon, regardless of previous herpes zoster or even if the patient has received Zostavax. In case of pregnancy, there is no AICP recommendation for RZV use. In case of immunocompromising conditions including persons with HIV regardless of CD4 count, 2-dose series recombinant zoster vaccine 2 to 6 months apart, that is minimum interval of 4 weeks, are given. Coming to human papilloma virus, HPV vaccination is recommended for all persons through age 26 years. It's usually 2 or 3 doses series depending on the age at initial vaccination or condition. Persons with age 15 years or older at initial vaccination should receive 3-dose series at 0, 1 to 2 and 6 months. Persons who are aged 9 to 14 years at initial vaccination and received 1 dose or 2 doses less than 5 months apart should receive 1 additional dose. And persons aged 9 to 14 years at initial vaccination and received 2 doses at least 5 months apart, the HPV vaccination series is regarded complete and no additional doses are needed. Vaccination is also given to some adults aged 27 to 45 years, which is based on shared clinical decision making. In cases of immunocompromising conditions including HIV infection, a 3-dose series vaccination is given, even for those who initiate vaccination at age 9 through 14 years. So this much for today. We'll be covering on rest of the vaccination series in our second presentation. Thank you.